Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about mixed dentition patients and whether or not they need palatal expansion / an RPE. Well, an RPE does give palatal expansion, but you can get palatal expansion with a variety of different devices. So the reason why I want to talk about this today is because it comes up pretty frequently in my consulting practice with StraightSmile Solutions. We do help doctors one-on-one with their cases, and we work with a lot of pediatric dentists, and this comes up quite frequently. And it's really a different way of thinking than maybe a lot of doctors were trained. So I am a huge fan of palatal expansion, developing the arches early and letting things kind of fall as they go. And often when you expand and get the arches the right size that they were meant to be, and I'm not going to go too in the weeds on this, but just reminding people that way back when, or even now, people who are in more tribal or primitive cultures don't have crowding. Crowding is a first world problem. It's a little bit genetic, but for the most part, it's environmental based on what we're eating. We're meant to nurse, breastfeed exclusively for 1-2 years at least. We're meant to eat a more abrasive, crunchy diet. We're not meant to be eating processed foods. We're not meant to be eating baby foods. That's not how the Native Americans ate. That's not how any tribal culture in Africa eats, any tribal culture around the world, and they don't have crowding anywhere. It's not just genetic. It's related to diet. So that being said, the best thing we can do to reduce crowding, which is not just a cosmetic thing, it's a functional thing, it's an airway thing, and it's a health situation. If our jaws don't grow the right size transverse, they also often don't grow this right size AP direction forward, and we need to make that happen. So that's why phase 1 is so critically important. I actually think it should be done in almost every patient, and it should be standard of care on every single child out there. There's very few children who don't need phase 1, as far as I see. The level of need, in air quotes, is different, but everyone can benefit from it, and you really should be looking at it from that way, because there's just so many health benefits to doing phase 1 treatment. But in any case, I do strongly believe in palatal expansion on many patients, if not most kids, because most kids could benefit in one way or another. So things that I look at when I decide whether or not a patient would benefit from palatal expansion, and again, this could be fixed or removable. One thing that people don't know that I use as a really great tool is measuring the transverse width of the upper arch. And I use the mesiopalatal cusp of the first molars as a landmark. So from this cusp tip, mesiopalatal to mesiopalatal, measure it. You can do it if you've taken a scan. It should be really easy. They usually have a ruler tool where you can measure it. If you haven't taken a scan, you can get a model and measure it, or you can measure it clinically. If you have a Bowley gauge, you can use that, or you can even just take a piece of floss and cut it the right size and then measure it later against a ruler. So the magic number for me is 40. And if it's less than 40 millimeters, then for me, for the most part, expansion is indicated. That's just the magic number. If it's over 40, I'll still reevaluate some other things. So that's a great way to, if you need a number to get started. But that can be different, right? Because if a patient had really teeny tiny micro teeth, well, that's not going to be accurate. Or if a patient, that's for average size teeth. If a patient had gigantoid, like humongous teeth, that's not going to be accurate. It'd have to be a bigger number, right? Okay, so what else am I looking at? I'm looking at the presence of crowding. So again, this is mixed dentition. So this only works in that magical mixed dentition age. Usually I say when 2 to 2 is in, upper and lower. So when the front permanent teeth are in, like in this patient, do we have front? We have mostly. At least 6 front permanent teeth. So 1, 2, I don't know if this is permanent, 3, 4, 5, 6. In this case, you could do it, right? Up into when you start losing your canines, and after that, my little method doesn't work. So it's that magical age around 8 or 9, 7, 8, 9, when I want you to start checking out the patients for the need of expansion. So I'm looking for the incidence of crowding, right? I'm looking for the incidence of any type of cross bites. There's one right there, right? And right there. I'm looking at the airway. I'm looking at any type of swelling issues in the airway. Of course, this is very severe. You want to send this one to ENT as well. I'm looking for vaulted palates, okay? Again, cross bites. And then also, of course, we're taking a look at the panoramic x-ray and looking for presence of crowding in a panoramic x-ray, you can see it, especially in the canine region. It's pretty obvious if you don't have space for teeth to come in, and also any types of risks of impactions of permanent teeth that indicate that there's just not enough space. So if any of these is off, I'm going to say, let's do palatal expansion. It's only going to benefit the patient. You don't have to go nuts. You don't have to do a ton, just a little bit, and it'll always help the airway, and it'll help to make everything fit in. All right, thanks so much. Hopefully that was helpful.